Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Answers Podcast, and we have a previous guest back on the podcast, and this is Dr. Donna Mazzola, who is a doctor of pharmacy, I should say, right? But she goes by the moniker Dr. Autoimmunegirl, and we had her on, it was probably a year or so ago. We talked about autoimmunity, but I thought it would be good to get her back on, maybe talk about some controversial thoughts regarding autoimmunity, kind of help express some of what autoimmunity is. And then we're going to talk about the role of the gut when it comes to autoimmunity. And she's going to talk about kind of a new protocol she's kind of putting out there to help people improve gut function and gut physiology. So, hey, Donna, it's great to have you back on the show. How are you today?
Thank you. I'm very good and excited to be here and get into some of these topics.
So as a refresher, because I know we've got a lot of new people that listen to the podcast since you were last on, give everybody like a brief description of your background, because typically, when we're thinking about functional medicine, we're talking about autoimmunity. The pharmacist, this is the person who's doling out medications. How do you get involved in functional medicine? So give us some background.
Yeah, definitely. So yes, I am a pharmacist, conventionally trained, worked in clinical practice, managing patients with chronic disease for over 10 years, and realized in that time, people have no clue. About diet, nutrition, lifestyle. And these are things like people living with diabetes who don't know what a carbohydrate is. Okay. It's like that simple. That was really eye-opening to me, and realized that, medicine has a part in treatment, but we're missing a whole other important element of nutrition, and really understanding, the root cause of why these diseases are developing and how we can actually prevent them. And so, that's part of the reason why I furthered my education and got a master's degree in human nutrition and functional medicine. The other part of that was personal. So I was diagnosed with Hashimoto's myself in 2015. And like I said, being conventionally trained pharmacist, I had no concept of food, lifestyle, environmental factors, gut health, that entire concept, and how it relates to the immune system in general. The only thing you learn in school is how it relates to diabetes and heart disease and asthma and high cholesterol. But these other diseases that we're seeing continuously grow truly as an epidemic, right? Autoimmune, in my eyes, how I describe it, is like an epidemic. Over 50 million people have it. It's rising at a rate of 19% per year. No one's asking why. And so that's really kind of that passion, and that personal story took me back to school to get my degree. And that's when I started Dr. Autoimmunegirl. And the whole purpose is just to kind of share what I learned, share what I research, so that people have that information, so they're empowered. You need to know the why behind it so that you can take control of your health.
Yeah, and I think it's a common story. I'd say a lot of us, I don't want to say most of us, but a lot of us in functional medicine had involvement in the other side, right? The allopathic side of medicine. Something happened to us. We were disenchanted. I was in medicine before. I wanted to be a pharmacist early on, thought I was going to be an MD. Then I wound up being, went to school as a medical technologist and was going to be an MD. Car accident, injury, unsuccessful treatment. I'm off to chiropractic school. And then because you start seeing these people with different conditions, for me, a family member got diagnosed with hypothyroidism and anemia and fibroids, and, and they asked for help. I don't know. I don't know what to do. That was none of that we did training just like you did training, but we didn't get into kind of the nuances like we do in functional medicine. So I had to go back to school and kind of learn a whole different aspect too. But, me too, my own autoimmune, Hashimoto's, Raynaud's, how do you develop these things when you're doing a lot of the right things? But it happens to all of us. And we've talked about on the previous podcast, we talked about all the time on how all the stresses, physical, chemical, emotional, microbial, trauma, habitual stress, all these different forms of stress overload the system and often trigger danger responses, which in my opinion is really at the root cause of most of the autoimmunity. But typically we see us coming to this because we have issues. So you can see people who are medical doctors and people that you would think never would be coming to one of my clients and was on the podcast as a medical doctor called it there is a parallel universe out there he didn't even know existed, this black hole called functional medicine, right? And then he's like, oh my God, I never learned any of this stuff. And as a cardiovascular surgeon, like talking about what diet should look like and some of these other things, like, man, that's not what we're learning. That's not what we're telling our clients. Okay. And it opens up a whole new concept or ideas of what's possible. But I do want to touch on a couple things you said. People seem to have no clue about how nutrition impacts their health. And I guess that's true. And then there's the other part of that there's people who have a huge clue and are concerned about it. There's people who have a huge clue and are obsessive in the wrong direction about it. There are people who are aware of it and are fighting each other about how pure their nutrition religion is and how bad everybody else's is. I call it circle the wagons and shooting in, right? And then there's a whole group of people who, I think you're right, don't really either understand how nutrition plays a role or they don't want to know. Exactly. Right? Yeah. So what do you think is the biggest reason that people have the disconnect many times between the food we eat, their health, and autoimmunity?
Well, I think there's just a lot of unknowns, and there's for like just the general population. And a lot of it comes down to marketing and how things are marketed as healthy or safe, or there's a trust in the system, which I get, but you got to question, some things. I mean, the amount of chemicals put in our foods, people have no concept of that. No, they're not even aware of the laws that regulate those things in the United States and our exposure to some of these toxins. But then just eating, right? Like I said, it's like marketing, this keto diet or this diet and all these fads, and as opposed to just focusing on like real food, like what's the benefit of these plants that we grow and we eat, like not even realizing like, the bioactive compounds in plants and the synergy that you get if you just consume that every day and the impact that it can have on inflammation. It's just like all of that is not even recognized, right? That's not even a concept that's talked about mainstream. The other thing is, like you said, like people, we say like, oh, we don't want to put anybody on meds, but there's a large percentage of people that want medication. Okay. They want to be on medication, and it's bridging the gap. So my mantra is always like, I'm balancing nutrition and medicine. So I'm not one extreme or the other. People want the medicine. They have to get the learning and the understanding to get themselves to the point where they understand the nutritional impact, the lifestyle factors, they start to feel better, and then you start to shift the balance. So now we can start reducing meds, getting off of them. And I always tell people, it's okay if you're still on meds, or our goal is to reduce doses, to delay progression. You do what you can. It's not one extreme or the other. And I think that steers people away when it's like, it's either all natural or it's all conventional. And that's where that whole group of people that's on meds and the conventional side is like, I don't want anything to do with that because it's scary. And like, my meds do what they're supposed to do, and I don't want to learn the other side. But if it comes from an approach of, no, it's okay, but let's get a grasp on why, like, what are things you should be avoiding? What should we incorporate? Then you can try to shift that balance. And I think that's really key and important, because I hate that there's this polarity between the two.
Yeah. And I was probably too loud a voice early on when I was disenchanted with healthcare, where I was like, okay, this is bad and we need to do this natural stuff. And, you go through that kind of ego phase and, you think you know everything. But I think where I've come in the last 10 years, and maybe even more in the last 5 years, is to the point where like we all have a place, right? And so, as you said, there are people who want medication. There are people that are just like, hey, just give me the easy way, right? And I'll do whatever it is. I don't need to change anything. I just want to do my life, and I'm fine taking 2, 3, 4, 6, 8 medications for the rest of my life. And I think they should have the opportunity to do that, right?
Exactly.
But there's people that do want the other option. Like, okay, but it's this blood pressure medication or nothing? Or is it blood pressure medication and then start this and maybe come off? And I think the challenge is we look at these two things like allopathic medicine versus functional medicine. Right. And really what it should be is allopathic medicine focused on its strong suits: acute care, crisis care, right? Get people out of danger. Let's get them stable. Management of chronic illness, chronic symptoms, and chronic disease for those who don't want to put the work and the effort in. And then functional medicine, we should really be saying, okay, that's their role. That's their job. We need somebody there for crisis care. If I get in a car accident and I'm bleeding out, don't take me to the functional medicine practitioner down the street for B6. It's not what I need in that moment, right? What I need is crisis care. And so we need to find that balance. And I think the more people like me, you, maybe some others in our community start saying, hey, let's try and bridge the gap, we're going to do better. I think sometimes we see that we see this term integrative medicine, like that's the person who's bridging the gap between the two. And I think in some cases that's true, but I think in some cases it's not true. I think with the philosophy doesn't change, the tool changes. And what I mean by that is, right, well, I'm going to give you this drug for these symptoms. And then, now that I'm integrative, I'm going to give you these 6 supplements for those same symptoms, instead of doing what functional medicine's role should be. And I'll let you kind of expand on this a little bit, which is, let's try and address root cause issues, address the root cause, and then help restore normal function, normal homeostasis. And then we don't need those things, right?
Absolutely. Exactly. So that drives me crazy when it's like, oh yeah, I hear people say like, oh yeah, I stopped all my meds and I just take these 7,000 vitamins and minerals and supplements. And I'm like, wait, you're doing the same thing. You're picking a supplement but what are you doing? Like how are we digging down into it's the same bandage approach, right? You're either bandaging with a supplement or bandaging with a medication. They're the same thing at the end of the day. And so, yeah, like from a functional medicine standpoint, are you addressing the stressors in your life? Like that's one thing, even personally over this year, that I have gained a huge appreciation for, just going through the stress of the pandemic and what it did to me and my autoimmune disease. I mean, firsthand experience, it threw everything out of whack. And so people don't view stress and sleep and those, like, I want to say almost like low-hanging fruit, but things that we can tackle, like we can identify means to get under and kind of mitigate those problems that are associated with them. But nobody talks about those things. It's not addressed.
It's not sexy is what it is, right? Yeah. So it's easier to say, here's 4 supplements to fix your thyroid physiology versus, hey, here's 4 things you have to do every day to improve your health so you don't develop thyroid problems, right? So work on your sleep. I got stuff to do. Facebook, Instagram, TikTok. Come on, I gotta get all this stuff done, right? People don't, the hardest thing I think is get people work on breathing. People just struggle to take the 5 minutes, 10 minutes to say, I'm going to work on breathing. It seems like you're doing nothing, but it's probably one of the most important things you can do overall. And it is, I think you're right. These are I call them, the fitness factors. You have to have a high level of fitness in your emotional fitness, your physical fitness, your chemical or metabolic fitness, your respiratory fitness, your habitual fitness. When we talk about stress, people always go to the emotional piece, but stress can be all different things can create stress, right? And there's good stress, eustress, and there's distress. And sometimes people want to have no stress, but that's not reality. And no stress is not a good thing either. There's a hormetic effect, right?
Yeah.
So we're going to get into this autoimmune thing because this is kind of part of your thing is like, hey, I'm Dr. Autoimmune Girl. You've had your own issues. I've kind of helped myself and kind of figured some of this stuff out. And there's a lot of people, I think there's some terms that I want to kind of talk with you and kind of get your take on some of these terms so that maybe the audience understands them better. So when somebody says they have autoimmunity, can you explain what that means from your standpoint? How would you explain autoimmunity to a client?
Yeah. So autoimmune, essentially what I tell people is there's a dysregulation in our immune response. There's a chronic inflammatory process going on that's not turning off within the body. And, when people think like, oh, I have a thyroid disorder, so I have an issue with my thyroid, I always come back and say, it's not an issue with the thyroid. There's an issue with the immune system. And the thyroid is almost like the scapegoat, like that's who got the short end of the stick as a result of it, And so obviously with autoimmunity, we're targeting, there's several organs, right? Whether it be your skin or your pancreas or your thyroid or your joints, or, we have a slew of autoimmune diseases out there. And essentially there's an imbalance and dysregulation with your immune system between self and non-self, and how we reduce that, or more should I say, like, how does that even develop? It's like these environmental triggers that we're constantly exposed to, intestinal permeability, which is our gut, which we're going to talk about, having that genetic predisposition as it is, like that's kind of my autoimmune formula. You have 2 out of 3 of those, and there's constant release of it or exposure or whatever it may be, like we're not reversing to fix those things, then that leads to autoimmunity. Just because you have a genetic predisposition doesn't mean you're doomed. I always say that, and there's things that we can control to not turn those genes on. And that's the thing with the way I see with autoimmunity is, I don't want to say it's self-imposed, but it's preventable. Recognizing kind of the environmental and external factors that are influencing that gene development and causing that immune dysregulation, leading to that chronic inflammation. I mean, personally, I see like why we have high rates of cancer, why we have high rates of autoimmunity. It's because we live a just chronic inflammatory lifestyle. Like everything we do is inflammatory, and inflammation in general is a good thing. You want your body to recognize that there's a flaw and turn on the immune system. And as a result, there's an inflammatory process that goes on to ward away that issue, right? Whether it be a virus or bacteria or whatever it may be. But having these constant exposures that we are, whether it be, environmental toxins, pollution, foods, stress, that puts us under this chronic inflammatory state. At the end, like that's going to lead to the negative outcome. If we're not turning it off, we're not recognizing it, we're not, our body just, again, our immune system never turns off. And in the US, we live within that chronic inflammatory state every day. The majority of the population does.
So there's I think the last I looked, there's about 8 different theories as to what is going on with autoimmunity, molecular mimicry. And so many times you hear this idea of an immune system out of control, right? And I have a totally different theory about what's going on with autoimmunity, and most of the people I seem to work with who have autoimmunity, instead of looking at it as an immune system out of control, I often look at it as more of a protective or adaptive response. And the reason I say that is because the thyroid hormone is the regulator of metabolism, right? And so cells are like people, right? We're either in normal everyday people mode, doing our wash, cooking, cleaning, working, having sex, digesting food, or we can be in a high stress state, in a defensive state, like fight or flight, right? And so we don't do well both of those well, right? If somebody was attacking attacking my wife, I'm not going to continue to cook. I'm not going to try and get a load of wash in. I'm not going to try and, take a quick nap. I'm going to go totally into defense mode. Anything on the stove is going to burn, right? Nothing else is going to get done. I'm in defense mode. And we can look at that like it's a problem, that's bad because in a cell, that means I decrease protein production. I decrease enzyme production. I decrease all these wonderful things, hair, skin, all these things I want to be nice and beautiful. And instead, I downregulate those. I downregulate my digestive enzymes. I downregulate pancreatic output. I downregulate insulin production in an effort to wall the cell off, limit anything coming into the cell, try and surround whatever might be in the cell and kill that thing. And to change the cell from normal metabolism, right, growth and development, to immune defense, or we call that cell danger response to kick in, the dimmer switch is thyroid hormones, T3. And so by deactivating T3, I turn off normal metabolism, and essentially you turn on that cell danger response in the cell. You increase the inflammatory mechanisms, you upregulate the immune system, and the cell does produce things like PAMPs and DAMPs. Those are those pieces of the pathogen that's creating the problem, pieces of the tissue that's being damaged, to send that out to the immune system and say, hey, this is the thing that's being damaged. But the thyroid cells also have receptors for those DAMPs and PAMPs. And the thyroid cells can then essentially go into autodestruct. They actually can turn themselves into immune cells, create damage, and then spew cytokines out to invite what we call the lymphocytes, or the white blood cells, to come into an immune system, to come into the thyroid gland and create the damage. So to me, when I see that, I don't look at that as, man, the immune system's broken. If I have one cell or one tissue I need to turn down metabolism, it makes sense. Let's turn it down locally. But if I have this going on long-term, chronically, progressively, then maybe it makes sense to turn down metabolism globally and address what's going on. So to some degree, in the beginning, at least, I look at the immune process, especially the damage to the thyroid gland, as this kind of protective mechanism. And it's one of the reasons why I think when we work on things to reduce the stress, right? And we're going to talk about the gut in a minute. Guess what happens? This thing that we call a dysregulated immune system, or immune system out of control, no longer seems to be out of control. It actually, the thyroiditis gets better, right? This damage to the thyroid gland gets better. We can see a thyroid gland actually start to improve function, more thyroid output. And if it was an immune system out of control, why does it get better? I think there's an intelligence to what's going on in the body that says, hey, danger averted. Let's kick it back into gear, constantly in danger mode, slow metabolism down, kill the threat. The problem is we don't feel good when that's going on. And we want to fix that, right? We want to fix the achiness, the tiredness. We want to fix it with putting more thyroid hormone into the system, when many times it's a system that's just trying to get rid of those things. You may agree, may not agree. What's your thoughts?
Well, I got a question for you then. So by the time you get a patient, right? Mm-hmm. By the time they're expressing symptoms, is typically at the point where there's already been a lot of damage done to the thyroid gland. Mm-hmm. And how do you, because it sounds like maybe you do use medication. But I mean, at some point, if the damage is already done, how do you reverse that? Because I've found it difficult to say that, for many people, once they've gotten to that point, yes, we can implement all these factors to help improve that dysregulation, improve the inflammatory response, and kind of balance everything. But we still can't get them off medications.
Well, I see a lot of patients either reduce or eliminate medications over time. Okay. So, first of all,
for sure reduce. I don't agree with that. For sure reduce, because now it's that whole balance, right, that we talked about earlier. So
some of the literature in the past said that the thyroid gland, once damaged, can't recover, right? It's done. Now the new literature is saying, hey, thyroid gland can recover if whatever's triggering the damage goes away. And we see that because people who've had autoimmunity now all of a sudden need less and less thyroid hormone. And whether they need less thyroid hormone because they're just absorbing more of it through the GI tract, which maybe is healthier, or we actually see the thyroid gland starting to recover. It takes about 5 years for the thyroid gland to kind of reinvent itself. All the tissues can kind of rebuild themselves. I think the reason why in a conventional model, you don't see people recover is because nobody's ever doing anything to reduce what's driving the thyroiditis in the first place. So you just have continual destruction. Yeah. The second thing that I think is important is I think hypothyroidism doesn't start when the thyroid gland gets damaged. I think the hypothyroid symptoms start as a result of decreased T3 in the cell. And I think that happens for many people long before they're ever diagnosed with hypothyroidism, right? And I'm sure even in your history, you may have experienced that already. I'm tired, fatigue, TSH is good. And it's not until somebody finally does some thyroid antibodies to go, whoa, you've got some damage going on in your thyroid gland. Oh, you mean this tiredness, this fatigue, this extra weight I'm putting on, the constipation, the low libido. You mean that wasn't just being, 30, right? That's not what it is, right? And we just don't associate it with it, right? So, I say this a lot on the podcast is that everybody thinks about hypothyroidism starting when the gland shuts down. By the time your TSH is elevated and your T4 levels low, you've lost greater than 90% of the function of your thyroid gland. That is not the beginning of a thyroid condition. That is the end of a thyroid condition. That's like saying a blood sugar problem starts when you're diagnosed full-on type 2 diabetic. That you develop that over 20 years. For most people, slow, progressive, unrelenting stress that builds up, that triggers that danger response is where they're living. They're living in an allostatic state for extended period of times. And the way we kind of modify physiology is we have to turn down the systems that are less important for survival. And it just so happens that T3 in the cell is the thing that is the kind of the dimmer switch. I have more T3, I turn off the immune inflammatory processes and the cell danger response processes. If I have more T3, I stimulate proteins, enzymes, and development. So that's why people are frustrated many times. Like, I'm tired, I'm fatigued, doctor just ran my TSH, it's normal, I'm good. But what did you say is one of the most chronic issues we have in this country? Chronic inflammation, right?
Oh, yeah, right.
So what does inflammation do to your TSH? It suppresses TSH, right? It increases the conversion of T4 to T3 in the hypothalamus, which will drop the TSH, and that inflammation can impact the pituitary gland and it can lower TSH. So if the number one issue we have in this country is chronic low-grade inflammation, and it suppresses the one and only test many doctors look at to determine if you have a thyroid condition, isn't that like a hot mess?
Yeah, right.
So I think what happens is as we reduce some of the, some of that stress response and that danger response goes away, what we see is that, hey, the thyroid hormone load that I needed before is now causing me to be hyperthyroid. I'm anxious, I'm anxiety, my weight loss is all of a sudden stopped. What's going on here? And you take a look at their thyroid panel and you see that their TSH that was struggling to get under 2 with 150 micrograms of T4 is now 0.04, right? What happened? Well, as I reduce the stress, I get more T4 getting converted to T3. Now I increase, my TSH plummets. And now that person's actually a little bit more hyperthyroid. So then we can reduce it again. And so where's that extra thyroid hormone coming from, right? If I'm reducing it and I'm getting saturated and their inflammatory mechanisms are going down, then it must be that something's doing a better job of producing T4, something's doing a better job of producing T3.
Yeah.
Does that make sense?
Yeah. Oh yeah, totally. And I agree with that. I mean, that's ultimately that shift we're looking for, right? I always tell people, if you're having symptoms, it's T3. Like, that's the hormone that we're trying to focus on. That's what's working at the cellular level. That's what you're feeling, and that's where you have that deficiency. And so, how do we get after that? And it's not necessarily by medication being the end all be all. Obviously, there are means to improve that conversion, and get it at the cellular level where it's needed. Like we said, reducing stress. There's so many factors that goes into it, for sure.
So I know you've done some posts. I know you've talked about it. TH1, TH2. Some people don't know what that means. Can you get into that a little bit? What's Th1 dominant, Th2 dominant? You hear people say Hashimoto's is Th1 dominant disorder, or other people say it's a Th2 dominant disorder. Can you kind of explain Th1 versus Th2 and how that relates to thyroiditis and thyroid damage?
Yeah, for sure. So first of all, what's Th1, what's Th2? Those are our T helper cells. And I always explain T cells as being like special agents within the immune system. Okay. And they when they activate, they release these these helper cells, like I said, are special, and then they release these cytokines that fight, they're part of their system. So we look at Th1 and Th2 as being in balance with each other, and so when you have a higher Th1 response, and obviously you have a shifted Th2, and then vice versa. A lot of times I look at, Hashimoto's, organ-specific autoimmune diseases. What research has shown is that those are more Th1 dominant responses. And so as a result, you want to shift that by increasing Th2 in order to put that back into balance so that there isn't that dysregulation. When we think about somebody who has excessive allergies or response to, parasite or worms or whatever, that's where we see more of an increase in a Th2. So Th2 is predominantly where we generally think of, more allergies as opposed to more of the Th1 response that we're looking at. And so how do we create that balance between the two so that we almost how can I simply put it, just kind of calm that immune system and that dysregulation, is by increasing T regulatory cells. And just by their name, from simple terms, that's what they do, right? They create that regulation between that. And a lot of that can come from foods. From the gut health, right? So we go back to gut. So specific probiotic species like Bifidobacterium has demonstrated, impact on increasing T regulatory cells, which would help create that balance, right? Vitamin D is another one that has been shown to improve T regulatory cells. That again creates that green tea, for instance, is one of those. And so, that's in the simplest of terms to try to explain between the two. It's, those are your special agent cells that are there on the attack. And when you have a, Hashimoto's or other, even like type 1 diabetes, other organ specific, you do have a dysregulation between the two and higher, more dominant in Th1 pathways.
So I guess, and I'll kind of summarize at the end, but there's two other terms I think get people confused. And one is, what's thyroiditis? What's Hashimoto's thyroiditis?
Yeah.
What's the difference?
Hashimoto's is specifically, it's the autoimmune, specific thyroid disease, right? So you can have hypothyroidism without it being Hashimoto's specific. And so, like I said, when we're talking autoimmune, at least in my my world, I'm talking about a dysregulated immune response. And so that's leading to a thyroid issue that you're having, right? And as opposed to it being not associated with the immune system. And so you can have thyroiditis is essentially, inflammation of your thyroid. Doesn't mean that it's being caused by an autoimmune mechanism per se. So I think that's when you hear Hashimoto's, automatically think autoimmune related.
Yeah, I think, what happens to people is they get diagnosed, they have a thyroiditis, right? And when you have, for the listeners, the thyroiditis is the inflammation of the thyroid gland, as Donna said. And so the question is then, what's causing the thyroiditis, right? It could be toxicity, it could be lack of iodine, could be too much iodine, it could be, any number of toxins that impact it. Could be, a thyroid cell that's identified danger and is causing self-destruct and inviting the immune system to come in and create some of the damage. But generally, the thyroiditis is just the inflammation of the gland. And I think from my perspective is that when we think about the difference between thyroiditis and Hashimoto's thyroiditis, the real difference here is the antibodies.
Exactly.
So if you have the positive antibodies, somebody's going to say it's Hashimoto's, TPO, thyroglobulin antibodies. If you don't have those, then it's just thyroiditis, right? It's an inflammation. But I think that the thought process regarding whether it's Hashimoto's or it's thyroiditis is kind of a gray line, because a lot of people who have thyroiditis eventually wind up finding out that they have thyroid antibodies, TPO, thyroglobulin. And it may take some time. And I think to tie in what we were talking about with Th1, Th2, when people talk about thyroiditis and Hashimoto's as it's Th1 or is it Th2, it's actually both of those from what I read. And that is in the early phase of the damage, it's Th1 driven. You have this part of your immune system that's kind of these mercenaries, like you were talking about. They're just going in there and creating damage, but then they report back to Treg cells and other cells and say, hey, here's where the damage is occurring. And then we see antibody production. And then as soon as we kick into that Th2 side of things, we can see the antibodies pop up. I think there's been a lot of attention on the thyroid antibodies and whether they're doing the damage or not doing the damage. And we may or may not be on the same page here as to what's going on. A lot of people put a lot of attention to trying to suppress them, but from the literature I've read, thyroglobulin antibodies don't cause any damage to the thyroid gland at all. They're just a cleanup crew. So after these blind mercenaries have come in there and shot up the place, somebody's got to come in and clean it up, right? And so we see thyroglobulin antibodies can be there, but not actually cause the damage. And then we talk about the role of TPO antibodies. That's the thyroid peroxidase antibodies. And literature does show that these can cause damage to the gland. But I think it's a 2017 paper on thyroid autoimmunity kind of points out that, hey, the amount of damage caused by TPO is minor. I think they, somewhere in the paper that I think they said was less than 5% of the damage to the thyroid gland is actually caused by the thyroid TPO antibodies. Most of it's done by this infiltrating immune system that's creating the damage. So where's your take on thyroid antibodies? And then we'll talk about a couple things like, does vitamin D, is it beneficial? Is it not beneficial? And selenium, is it beneficial, not beneficial? Because the literature is really controversial on this. I don't think everybody's got a clear handle on it. I think it's anecdotal many times that we say, hey, it seemed to help work for me. And I don't think that's problematic at all. But I don't think, I'm not saying the consensus in the literature one way or the other, whether it's good or bad, but I don't think doing some of these things is harmful, but I don't know that it really changes the clinical outcome. So where's your stance on thyroid antibodies from what you've read? Because I know you're into the science. What have you read about what's happening with thyroid antibodies? Should people be concerned in suppressing thyroid antibodies? Are they the problem as you see it, or are they more a mirror of a problem?
Yeah, so I look at antibodies also when you're looking at blood tests is as a reflection of the inflammatory status, right? And with what's going on. And so that's really what I look at TPO antibodies for. It really gives kind of a measure of the inflammatory process. It's almost telling us if everything that we're implementing and doing, like what's the impact of it? Do I think, is there, a lot of people are focused on, let me try to get it down to zero, and that's my end goal. And that's not always possible, and that's okay. That's fine. It's more so of reducing that inflammatory process. We are going to see it trend down, essentially. But thyroid peroxidase, there's so many other things that are involved in thyroid physiology than just focusing on, is it TPO? Is it this? But it's the nutrients also that are factored into that. And when we think about how we synthesize thyroid hormone, T4 and T3 in the cell, we utilize thyroid peroxidase, and that's an iron-dependent enzyme in order to do that. And so iron is just one thing that I think is so missed. in people with Hashimoto's, and also when we're talking about TPO and its role and how, obviously, like, you have thyroid peroxidase, these antibodies that are working within that segment, right, that are impacting that conversion, that synthesis of the hormone, whatnot. And so sometimes in my mind, it's looking at what are the other nutrients involved in the pathophysiology that we can ensure that we're getting adequate amounts of. And then you kind of see that shift in the overall, physiological process that's going on with autoimmune thyroiditis. So it's not the end all be all. You mentioned thyroglobulin. I mean, some people don't even have elevated thyroglobulin, and it's like, that's great. It's not even worth checking, but focusing more in, we check TPO, obviously identifies that there's autoimmune process going on, right? That's kind of the differentiator beyond somebody saying, oh, I just have an inflamed thyroid versus an autoimmune condition going on. That's kind of our numerical factor that we're looking at, right? That what can we test to see where that antibody response is. But to me, honestly, it's a measure of the inflammatory process for somebody with autoimmune thyroiditis. And if we can bring that down, we're bringing that down through mechanisms that are reducing inflammation. So rather than focusing on TPO itself, focusing on mechanisms to reduce inflammation. And as a result, we will see it trend down. And that's what I've experienced.
Yeah. And I would say that reducing inflammation and reducing whatever's causing that inflammation. What's the trigger, right? Because as you said before, inflammation is not necessarily a bad thing. It's chronic, sustained inflammation that's really the biggest issue. And we do sometimes rush in there to reduce inflammation. And sometimes it's really important to do that. But at times, what we need to do is be aware that, hey, why is the body doing this? Like, what's driving this inflammatory response? Which I think, because I want to make sure I keep you to your time. When we talk about things that drive the inflammatory process, right? This is a good segue, right?
Yeah.
A large portion of the immune system surrounds where?
In the gut.
Yeah. So now you've been spending some time on gut function, gut health as you're learning about it. Now you're coming out with a protocol, like a 4-week protocol to try and help people improve their GI function. So can you talk a little bit about what that is, and is it testing? Is it evaluation? Is it treatment? What's the gut protocol that you're going to kind of lay out for people here in a short period of time?
Yeah. So, I mean, it's honestly keeping it simple. Everybody has issues in the gut. And if you're eating a, standard American diet, then you have what we term leaky gut, right? And essentially, like you said, I mean, the vast majority of your immune system is in the lining of the gut. That's your mucosal gut lining. It's that barrier that's built. I mean, you intake foods or whatever it may be. I mean, that barrier is what keeps those toxins from flowing into your bloodstream. I mean, you have other mucosal barriers, not just your gut. Your skin is a mucosal barrier, your nasal passage, vaginal mucosal areas. I mean, those are all mucosal barriers. Your lungs, right? There's surfactants there that when you breathe things in that keep them from also causing that. So your overall mucosal system is important, but your gut is your largest. That's where our biggest focus is. And all these things that we're doing and eating, we're breaking down that barrier. We're breaking down that wall. And therefore you're getting these toxins, food antigens, things that are leaking into your blood that are creating a response to that. Like I hear people, oh, well, as I've aged, now I can't eat this. And 5 years ago, I used to be able to eat legumes and now I can't tolerate them. And I used to be able to eat, and it's like, okay, there's a reason for that, because over time you've broken down that gut barrier. You're now generating an negative immune response to those things because for that reason. And so like your gut microbiome has a lot to do with that. The bacteria in your gut, an imbalance in that bacteria that we typically see with people has a lot to do with that. Various nutrients, how do we rebuild that lining? How do we maintain it with various supplements and nutrients in order to keep it strong, keep it secure, and keep it protecting you? So there's a lot that goes into it beyond just food. And so, yeah, I've created this protocol that on a weekly basis, we're going to incorporate probiotics, but we're going to start with probiotics that we know are, they're going to target things like candida overgrowth, or various microorganisms that we're going to target and kind of kill off with that before initiating other supplements that maybe will help improve our gut lining. But if you incorporate things at different times and you have this dysregulation, you can actually do more harm than good. So it's kind of like time dependent and giving it, and obviously a big part of that is changing the diet, right? And so there's a complete protocol that focuses on anti-inflammatory foods, removing them, giving your gut a chance to heal. Within 7 days, if you remove those inflammatory foods, you can heal your gut lining. But we got to make it stronger, right? We got to do it over a 4-week period. We got to give it a chance for those IgG antibodies to come down, right? That's going to take about 21 days. So there is an art behind the science, a reason why, we say 4 weeks and then reintroducing, seeing what we react to. And then it's about maintenance after that. And so our gut, I know it's like a lot of in conventional medicine, a lot of times they view it as like, oh, okay, this is like the new term that everybody's focused on. And it's, leaky gut, but it's a real thing. And if you can improve your gut lining, in turn, that's going to positively impact, your overall health, your immune health, especially, by simply, and it is simple, by just kind of like changing what we eat and what we take in.
Yeah. And so when it comes to, we talk about thyroid issues, we talk about autoimmunity, as you said, about 70 to 80% of the immune system is in and around the GI tract. We have these things called mast cells that surround the GI tract that if you have allergies and food reactivity, these are the cells that when they notice danger can start spewing out histamine and other cytokines to try and help the process, right? But unfortunately, again, it creates negative symptoms. But there is lots of evidence that shows that problems in the gut can trigger inflammatory mechanisms that can trigger that danger response of the thyroid gland and trigger that thyroiditis to occur. And we know one of the things that happens is the bacteria can shed their outer coating. LPS is what we see with gram-negative bacteria, LTA with gram-positive bacteria, and both of those can be danger signal molecules that float around in the bloodstream. And guess where they can blind? They can both get into the lymph tissue that has a direct impact to the thyroid gland, and those things can directly bind to the thyroid cells and start that initiation process, or those things can get into the bloodstream and trigger chronic inflammatory, upregulate the immune system, and trigger thyroiditis via that mechanism as well. So the gut plays a huge role in the things that can trigger thyroiditis, autoimmunity, and hypothyroidism, and even hyperthyroidism as well.
I mean, our mucosal cells, that's the immune response you're getting there as a result of IgA. And so that's really what kind of creates that oral tolerance, is what we refer to it as, right? And so like when you have that reduction in IgA, like your body, things that wouldn't normally be, it would react to, it's reacting to. And so that's a key factor of healing the gut, is there is a deeper immune related response to it. And by doing that, you're going to improve that overall oral tolerance. You're not going to start reacting to things that you wouldn't normally. And things like dysbiosis in the gut reduce your IgA production. Just vitamin D deficiency reduces your IgA production. There's chronic stress reduces your IgA production. I mean, there's so many things that are connected to that. And so that's the complexity of it, right? It's like all of these connections and how they play a role in the bigger picture of the immune system.
So I know we've got a hard stop here in a few minutes, but is what you're going to roll out, this gut protocol, is this a class that somebody joins for 30 days or 4 weeks, or how does somebody get involved in your 4-week gut process or protocol?
Yeah, so basically it'll be just something that can be purchased through my website once I roll it out. And it's a 4-week protocol that explains essentially the science behind the microbiome, what is leaky gut, and defines what that is, what contributes to it, what foods that we need to be avoiding, and really gets into the relation between Th1 and Th2 and those pro-inflammatory cytokines that are being produced, eliminating those foods, symptoms obviously associated with it, and then why we're eliminating those foods, what's created as a result, and then really just jumps into the foods we're going to incorporate into our diet. It gives complete shopping list, week by week, foods that are going to be eaten, recipes that are part of that. Within each time point, I have 3 different elixirs that you'll make and drink every single day for breakfast, midday, and before bed, that all have gut healing properties to them. And then various supplements that, like I said, are going to be introduced at different time points. So I'm calling it the PUR protocol. So week 1, you're going to purge. Week 2, you're going to integrate. Week 3, you're going to regenerate. And week 4, you're going to heal. And within each week, you're going to do something different recipes every week, different foods that you're going to incorporate. And honestly, after I did it, I did do a GI map after, and I have a post about this, but I was shocked. They were perfect. I mean, I had 0 dysbiosis, pH level was perfect, no candida growth. And I have done them before, and I've always, and it wasn't that way. So it's meant to be 4 weeks. It's meant to teach you the science why, because I truly feel if people understand why, they're more likely to stick to it. And it kind of sets you up for success. I mean, from that point on, what foods you should not eat, what foods you should eat. And after you've reincorporated them, what causes you issues and what you should eliminate, at least for a time being, for a longer period of time, right? Obviously, you have more work to do to heal the gut. But eventually, I think you can start incorporating certain foods that maybe you couldn't before. You should be able to, right? It's not permanent. And I think that's the point here, is that you can heal it, give it time. And in time, people always ask, well, you think I'll ever be able to eat legumes again? Yes, of course. I definitely think so. But you have to give your gut a chance to heal.
Awesome. So we're on the dot for when we've got to make a hard stop here. So just finish up by letting people, if people want to know more about Dr. Autoimmune Girl and like what you do, and even about this upcoming course that you're going to have available, where do they find you?
Yeah, so my website is DrAutoimmunegirl.com. On Instagram and Facebook, same handle, Dr. Autoimmune Girl. You can find me on there. I post pretty much daily, and just topics related to everything we talked about today, just immune health, thyroid health, gut health, just empowering you to live a better life, a healthier life, and understanding, like I said, the why and the science behind it. Nothing that I provide is based on my opinion. It's all based on research. And that's, I think, a key aspect of what I put out on my blog.
Awesome. So Donna, I appreciate you coming back on the podcast. We'll try and do this again probably in a couple of years and see if we get you back on. I appreciate the conversation. This is more of a discussion than it was an interview process. So I think that it's really good for people to kind of hear maybe some similar opinions on things and maybe sometimes differing opinions on things. So I think it's really good. For any of the listeners, always keep listening to the podcast. We've got people listening from all over the world. It's crazy when I look at who's listening to it, where they're coming from. And I get, people contact me like, hey, I need some help. And I'm from India or Sri Lanka or, these countries all over the world. So it is amazing that we have this kind of power and influence that you and I, sitting in our homes in the United States, are having a positive impact on people all over the world. So for the listeners, keep listening, keep sharing the podcast. If you get a chance to rate us as high as you think appropriate. That helps. And otherwise, stay tuned for this episode coming out in future episodes of the Thyroid Answers Podcast. Donna, thanks so much for coming on, and have a fantastic day and weekend. Okay.
Thank you. You too.